once again, welcome to the Okwako Outlook with another day where we want to talk more about mental health. Last time we talked more about addiction. We had our guest, and we are privileged to have him again on the set with us. Before I introduce him, allow me to give a shout out to Pride for giving us this space. Thank you so much. And we ask your viewers, wherever you're coming from, if you're coming to Kenya, from whichever country, they have lodges, they have conference halls, rooms, and everything that you would want to know. And whenever you reach out to them, tell them you've been referred to them by the Okwako Outlook, by the one and only Jefferson. And therefore, before further ado, I want to welcome again our guest today. Allow me to introduce him. The one that is joining us today, he's called Japheth Murimi Kijinji, right? If I'm pronouncing your name properly. Japheth Murimi Kijinji. He's a counseling psychologist and international certified addiction professional with over 6 years of experience working with youth across Kenya and East Africa. He currently serves as a clinical lead at a prominent NGO and a clinical coordinator at, it's called Symmetria Recovery Center. It's in Nairobi? Kamulu, yes. Kamulu is within Machakos County. Nairobi County. It's Nairobi County. Japheth is not only a trained professional, but also someone with lived experience in addiction recovery. Having been sober for now 7 good years, his work is focused on helping young people break cycle of shame and emotional distress, and he's widely respected for his hands-on work in schools, rehabs, and online platforms, e.g. TikTok and YouTube. So he brings rare, deeply human perspective to mental health, and we are honored to have him with us today. How are you?
I'm fine, thank you.
Welcome on our show again. Last time you were here with us, we had a very good conversation, and we thought it wise to invite you back. Okay? Yeah. So you ready?
Yes.
Today we want to go. We want to go a little further. I want to look at. We want to look at the therapy demystified. That is what actually happens in session when you are in therapy, counseling from addiction, whatever. And then we're also going to look at humanizing therapy, that is addressing fears and empowering first-time client. How do you empower the first client until he's able to cope up with the therapy? Okay, so what is therapy really like for someone who has never been in a to a therapist or in a therapist whatever center?
Number one is it depends on where you're coming from.
Mm-hmm.
There are people who have been told by their bosses you have to go to therapy. That is going to be different for them from somebody else who has had enough of it and
decided to do it by himself.
Therapy. There's somebody who's doing it to keep their marriage intact. They have made a blunder.
So because you want to recover your marriage.
You want to be forgiven.
You want to recover your marriage.
Yeah, so your experience depends on your motives.
Yes.
But for somebody who has never done it, or no matter the motive, it actually depends on. It's very different for different people. Yeah. Yes, people who do it for school. It just depends on the reason why you feel you want to do it, or the compelling reason at that point.
Have you ever had this experience where somebody, for the first time, somebody is coming to you, he doesn't want to open up because he still doesn't know, he doesn't trust you, he doesn't know whether his story will resonate well with you, and now he's seated there? Or have you ever had a client who has, instead of you being his therapist, he's the one now counseling? Have you had a scenario like that?
I may not want to say whether I have or I haven't, because they may watch and feel like
no, this is actually a learning. It's a learning platform.
But from even when we were being trained, we were prepared for such scenarios whereby not everybody will come in comfortable for therapy. Others will take time to sit in with you, learn more about therapy, and it happens. And there are those, of course, that will come and feel they already have the answer.
And they want to cancel you.
My main objective in that therapy room, or wherever you're doing therapy, is to create a safe space for you to be you. It's not about me.
So you allow them to express themselves.
Yes. If that day you're quiet, that's who you are. At least feel safe and secure being quiet. That I will not judge you. That I will not say you're closing up. Or instead of using words like closing up, you just say the person is not yet there. That's where they are, and it is okay.
Because I remember the first time I went to a therapist, I broke a glass. I got angry. She was asking me questions, and I grabbed that glass. Really, I hit it on the wall. So it was my first time for a therapist. Yeah. So yeah. So how do you bring somebody to a point of knowing that now, because this is the first time he has never been to a therapist. One, somebody who people, as you have said, people go to therapists differently. Others go to therapists because they want something. They want to hear the story that will help their marriage restored, or they want to hear the story that will tell them this business would have done this way if you did this, so that they can go back and do it and restore their businesses. But now you as a therapist, you are concerned with the well-being of this person, the mental state of this person. How do you make this person feel, or at what point do you realize that now I want to take it up and make this person know that this is exactly what he wants, but not what he think will come out of this?
Number one, it is always an obligation to spell out to the client the ethics I'm supposed to have or uphold, like confidentiality and many others, maleficence, beneficence, all of those. It is my obligation to make the client aware of my expertise. This is what I'm able to offer, this is what I'm able to do. There is that. It's the right of the client to know, or the professional bit that I'm offering.
That everything you're sharing with me is safe with me.
Yeah.
Okay.
And so the other thing is myself and my style now is I come in as a collaborator. I'm not coming in to solve your problems. I'm not coming in as a know-it-all. I'm not coming in as somebody who has life figured out and now I'm supposed to transmit that to you. I'm coming in as a collaborator.
To walk the journey with this person.
Create a therapeutic alliance, just to walk through the journey through your eyes.
Yeah.
You see, I'm just coming in there as support.
Okay, all right. And what do people fear most about seeing a therapist, and how do you address that?
The biggest fear is that your story will be shared or be used, or that others, they fear that because we've done psychology, we manipulate them into those things. So how I go about that is assuring confidentiality and assuring that the client that in my interaction, I'm not supposed to harm you. I'm not supposed to manipulate you. I'm not supposed to do that. And I also psychoeducate the client on the interventions. I'll use all the skills I'm using so that they feel safe. So that when I ask a certain question, you understand why I'm asking. When I ask you to do a certain assignment, you understand
why you are asking him to do that assignment.
Again, I'm coming in as a collaborator, not as a master. This one I'm not telling you close your eyes, knock this way. No. It's I'm just holding your hand and we walk through together every step of the way.
I don't know whether this is part of therapy, but I remember just taking you through what went through me, what happened to me. It was not in Kenya though. So I was told to close my eyes and think of a very scary instance in my life, or like asked, what would people say about you on your funeral? So I closed my eyes because now, of course, you have already inculcated in your system. Like the mind has already said you're dead. Now you're viewing the people who around what they'll be saying about you now in that coffin. And I remember seeing somebody I thought was my very good friend when I had closed my eyes. Now, like I'm imagining what people will say on my funeral, and I see this friend of mine, and what he's saying to me is like, you did a very good thing to die. Like he's telling me, thank God you're dead. You are a stumbling block to I don't know what. So and so this is the person I love. So I woke up, and you know what what happened? I told the therapist, I'm not continuing with this. I have to go. I have to go up and think of, because this is my best friend, and now that what happened. So the fear that I also had, what you just mentioned, is my friend, whom I thought was my friend. Now he's saying things like those ones, and I trusted that the way the therapist told me to close the eyes, what I will think must be true. So that person might be thinking of the same thing. So what do you build trust with clients? Because some clients, how do you build that rapport?
Yeah, it's more about also me being authentic and genuine. Yeah, and being open with the methods I'm using. For example, that method you just described is visualization. So if I was a therapist, I would tell you I'd like to use visualization, and the purpose of this is because we are going to do this, and based on your treatment plan or the objectives of the session, is going to help us in this way. Yeah. Informed consent is very important. I'm working with clients. It's not professional to do things or to ask clients to do things without them knowing.
So that you must have their consent first.
Yes.
Okay.
That this is the tool I'm using. This is going to be the impact or lack of it. So,
so you must seek their consent.
Yeah.
But this is a sick person. How do you seek? I mean, like, okay, I see doctors do the same, but now, this is a mental thing. This is a sick person. He's come to seek for help. You must be in a position as a therapist to know what he wants. Why would you seek his content?
Could be a sick person, but it's a person. It's a person. So we are not treating the sickness. We are treating the person of the sickness.
Okay. So it's about this person. So this person has to give a consent first.
Yes. It's about, even if I don't even like that word sick per se. But even if you are sick, it's part of the informed consent. So this is a problem, this is a sickness, and this is what we are doing to.
Yeah.
Yeah, you see, it's very important to and not just as a therapist, as human beings when we are dealing with each other.
Yeah.
Humanize. You see,
You have to be a bit empathetic.
the only times it may be difficult to humanize is when your life is in danger. When you're coming to me with fists and a knife, at that moment I may not be able to humanize because I want to stay alive. But the other times.
But have you encountered such clients who have maybe and rogue, very violent, and
those things are there, but it's not the way people think. You see, we are trained. We are trained. And even in cases where somebody may be violent, we have safety measures. It's just like any other job. It's like a plumber. You know that sometimes you can get your hand stuck on the pipe, and this is what you're supposed to do. Things like those. So just like other professions, we also have our toolbox. It's only that sometimes our toolbox is in the mind or some.
So is a therapist a doctor?
A therapist can be a doctor, and a doctor can be a therapist. But I am not a doctor.
You're just a therapist. So do you sometimes seek the help of the doctors?
Absolutely.
If a client is in a bad condition?
Not a bad condition. If through my screening and assessment there is a co-occurring disorder, or I think that this person needs to see a doctor, the professional thing to do is to refer.
Okay. After they have treated, they come back to you as a therapist.
They can go after, or they can go together.
Oh, okay. They can still go hand in hand. Huh? So what's the difference between counseling psychologist, psychiatrist, and a life coach?
Let me start with a counseling psychologist. Any psychologist is a person who studies humans' behavior, emotions, and way of thinking, and those patterns. So a counseling psychologist, counseling is all about the skills. So a counseling psychologist uses skills to help people with their behavior, their patterns, and their emotions. Simple. A psychiatrist, on the other hand, is a trained doctor who has what do we call it when somebody specializes, who has specialized in mental disorders and is able to prescribe medication for those mental disorders. A life coach is somebody who imparts people's life by creating programs or interventions that they should do to achieve certain goals. So a life coach can tell you what to do.
So in matters mental health, the three of them go hand in hand, or there is one that mostly handles the mental?
Depends on the issue you're having, depends on your goals, depends on the clients, and even for we have different programs. There are programs that are created that incorporate the three of them. There are counseling psychologists who are life coaches. There are counseling psychologists who are psychiatrists. So it all depends on.
And we just have a psychologist, a psychologist who are not doctors as well. But like Madam Regina, I think she's a psychologist, counseling psychologist, but she's not a medical doctor. So can therapy work for people who don't feel sick but are struggling?
Absolutely. Therapy is for everybody. Therapy is for everybody who thinks, who has behaviors, who has thoughts that stresses them, or is undergoing stressors, who has behaviors they would like to change, and who is unable to regulate their emotions, or they are undergoing very heavy emotions. And for sickness, for mental illness, these are disorders that are now diagnosable across the board.
So somebody could be struggling and he's not sick. He needs a therapist. Okay. So what are the roles of trauma-informed care in therapy?
Trauma-informed care is a type of care now where we therapists, we understand your issues are coming from a point of processed issues,
Yeah.
and that we are supposed to address those issues, and that I should be careful in my interventions not to re-traumatize you. So trauma-informed care is basically care that's geared towards healing your pain and not adding any more pain in your life as you continue the journey of healing.
Of healing. Oh, okay. All right. And what should someone look for in a good therapist?
A good therapist, number one, is somebody who's genuine, authentic, doesn't lie to you, gives honest feedback. A good therapist, you'll feel heard. Somebody who listens to you, like you speak your problem and you feel that they are helping you understand your problem. A good therapist is trained and licensed.
Trained and licensed.
Yes.
At least he has experience.
Yeah, they are trained, even if it's they finished last month. They are trained, they have the certificate, and they are licensed by the board.
You have all the necessary requirements to be a therapist. What I wanted to ask this. This is of in a rehab center. If in a rehab center, what normally happens in a rehab center? I have been to a therapist. I've never been to a rehab center. What happens? Like, what kind of people do you deal with in a rehab?
So now, for rehab centers like ours that know what we are doing, because rehab centers are many. I can only speak on those
the one you know.
Yes. So what happens is mainly the first thing that happens is admission. Of course.
You admit the client, the sick person.
And on admission, we take all the necessary information, the history, the accusations, if any, because some of the admissions are involuntary. The second thing that happens is orientation. By orientation is we explain to the client why they are here and what is it that we'll be doing, how the program is designed, and what is expected of them and what is expected of us. We inform them of their rights and their obligations too. The other thing that happens is screening. Screening, we can screen for drugs in your system, we can screen for severity in your addiction, we can screen for anxiety issues, depression, we can screen for any co-occurring disorder that we maybe we observe that is coming off in the allegations or right. And that is done by both the psychologists and the psychiatrists like you have there. And then we have the assessments. Now is to go from this issue of the screening, what caused them, how's their life like. We do an all-round assessment of their life, including legal status, marital status, mental status, emotional status, physical status. The childhood growing up, we want to know everything so that we can fish out the underlying issues. And then the other thing that happens now is the treatment planning for any underlying issues. If you have a mental condition, there's medication. And for these other issues, we encourage using evidence-based interventions. These are interventions that have been researched and shows that they are they have a high rate of success. So even the therapy that we use is evidence-based therapy, like cognitive behavioral therapy that focuses on a triangle of thoughts, feelings, and behaviors. We have dialectical behavioral therapy that focuses on emotional regulations. We have 12-step facilitation that focuses on treating addiction from a point of connecting to yourself to a higher power or higher purpose. We have motivational intervention, which doesn't allow us to say clients are in denial. We just say the client maybe is not yet ready to. So we make a program that incorporates all of that, and then we use that in both group sessions and individual sessions. And then the other thing that now happens in rehab is we create a relapse prevention plan, and then we plan for aftercare, and then we also do family therapies to help the whole family. That is what happens in rehab. Yeah.
It's
So
a
they
big,
got, yeah.
it's a whole lot of a whole lot of
That's
things.
why it takes time.
It
That
takes
is why,
time.
for example, if you come for 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 our program, it's 3 months. There's a lot to do. We have to.
Do
There's
you think
something I forgot
do
in
you think
the
3 months is
beginning.
enough?
After admission, before I answer that, there is a period where we are dealing with withdrawals, we are dealing with all of those things. 3 months, whether 3 months is enough, 3 months we cannot say is enough for anybody. You see, the 3 months is there for objectivity reasons. Because in those 3 months, we are able to have these sessions. In those 3 months, at least we are sure the withdrawal symptoms have subsided and you have enough tools to help you. But even for people who are not in addiction, I think we all need a break from. So that is why we have follow-up and aftercare.
Okay.
Because the nature of addiction is not that you are cured after 3 months. It is treatable. Yes, it's like diabetes. We have to have continued care. It's called continuum of care.
So after 3 months of being in admission, when you go home, there is that the follow-up.
Yes, the follow-up now to make sure you're using the tools. You're not alone. You have support.
So for the young ones, maybe they are students. There's a case I think a certain lawyer friend of mine was sharing with me. This girl, she's actually a minor. She's I think 15, but she's a tomboy. She's a tomboy. I think I know what you mean. Let's say she's changed the sexuality because she feels inside her she's a man. So the mother couldn't stand her. So she's gone for rehab. The 3 months are over, but the mother doesn't, because she's
still a man.
She's single parented. Yeah, the mother is the only one. The father is not there. So the mother thinks she cannot come back. She's still now. Is there a way in a rehab center for parents like those ones to understand that some of these behaviors, I mean, is there a way somebody can be rehabilitated from a behavior like that?
Now, you see, like, I may not answer on behalf of that one, maybe on behalf of
any other
myself,
case.
Because I know if you bring me a case, there's what we call placement. Why am I placing you in rehab? Do you meet the criteria? Do you meet the addiction severity that is needed for you to be in inpatient care? Because we have levels of care. We have brief intervention. We have outpatient level of care. We have intensive outpatient, it's not even 3, and we have inpatient. And sometimes we have even intensive inpatient, depending on the book you're reading. So for me, placement is very important. Right from the onset of screening, we have to understand the severity of your issues, because there are some issues which don't meet the criteria that is required to place you in inpatient care, not unless you, the person, wants to be. But there are others that meet the criteria of inpatient care that even if you don't want, we can still do it voluntarily.
Not forcefully.
Yeah, so it all depends on. So I don't know whether the lady who feels like a man had an addiction issues for them to be. I don't know whether the rehab they are in is to rehabilitate people's sexuality or is for drug.
But
so
is there a possibility of rehabilitating for sexuality?
I don't have all the information in the world. But I'm being careful around that question.
That's another thing. Another thing I see. That's another thing I see that is really, really on the rise, especially in our schools. Even the former CS education, the late Magoha talked about it, where he was saying if you feel like you don't be in a boarding school, things like those. It's happening, but So it's, I think, the matter of parents also to get, they need to. Do you think there is a contributing factor towards that? Would be a negligence of parents being aware.
The issues of sexuality.
Yeah, or but let me just say about any other addiction apart from even the sexuality, because sexuality is one of the things that is happening.
Yeah.
That you gave birth to a daughter and tomorrow she's coming back, she tells you, I feel like I'm a man, things like those.
You see, we need to create a distinction between what we call addiction and mental health issues and social issues all right. So I want to say here, anything to be termed as a mental health issue is anything that impacts you negatively, the people around you, or the society.
Yeah.
So, for example, you could your sexuality could be not bothering you, but it's
bothering others around.
That automatically becomes an issue. You see, addiction, on the other hand, is something that you do for short-term relief, but that thing has long-term consequences, and you are unable to stop. So that is to say, some sexual behavior can be addictive, or some people can get addicted to sexual behavior. So there's usually a need to distinguish between sexual issues and addiction. Yeah, it's the same mind. So in schools particularly, you may find that there is this sexual behavior that is going against the societal norms and the cultural norms. So the big question is, how is it affecting the doer of the behavior and the doee? The doee the doee is the rest of us, because we are the ones who are getting pissed at the doer. So you see,
there is a way it will affect
both of them. So, and it's a very sensitive issue, because if not tackled the right way, you lose both the doer and the doee. That one doesn't sound right. But
the perpetrator and who have the perpetrator.
And then another thing, there's something we call labeling. Let's say you are a young guy.
We dealt with the labeling previously.
You're a young guy, you are having some behavior. Then we, teachers and parents, will label you as a criminal. And then for some reason, your mind personalizes that label. You end up being a criminal, which you are not, because of something that could have been dealt with. So let's be careful around this issue. If it is a sexuality issue, let's stop looking for one reason that made this person this way. Some of them are just experimenting.
Factors.
There could be other factors. Let's also individualize these issues and not make them about. Because if we judge one person,
you don't know why.
You don't know why the next person is doing so.
Because again, I think people don't just wake up and do things. There has to be a root cause of that. So if you personalize things and then make somebody suffer for a mistake that he didn't even.
The people are doing that because they are criminals. People are doing that because. I'm
not
saying
like
whether it's right or wrong. I'm being very careful. I'm not saying whether it's right. I'm just saying, if it is an issue, let it be tackled from an individual point of view. Let's find out, is this person biologically predisposed? Is this person psychologically predisposed? Is this person socially predisposed? Because socially is where people are doing things and then they are.
So
you
find yourself in the mix.
So you have to be very, because if we label all of it as social, the peer pressure, what of the person whose problem is biological, whose problem is, some of them it is even a spiritual problem. So you have to
get to differentiate.
You have to be very careful around this issue, because you can lose people because of that.
So we are winding up, and I have this last question I wanted to ask you before we take a short break, and we'll be back again. Is there a wrong reason to go to a therapy because some people just feel sick? I think we had touched a bit of it. We can go, just close with that. Is there any reason, like, just go to a therapist because some people just feel sick? Like, let me just go to a therapist, I'm feeling sick. Have you come across such kind of experience?
No, this one is not. I'm not advertising myself, but I'm saying anybody who thinks has behavior and has emotions is
go to a therapist.
Candidate for the therapy. Therapy is not just for the
Addicted
unwell person or the sick person.
Yeah.
It's also for you. Maybe there's something you don't understand about life or about yourself. It is not a problem. You just don't understand. Maybe you don't understand why you do some things. And these are not per se. Maybe there are things you do so well and you want to understand why you do them so well. Come. So therapy is not just for problem.
Okay.
Yes, it's ideal for problem, but it's also for, you can even use it for self-care. You've had a long week at work. You need somebody to
talk to
about
you just look for
your work issues so that you can deflate. You are a writer and you are finding that ideas are not coming. Come. I'm not an author, but
at least you'll advise me on 1, 2, 3.
Not even advice. That's the other thing. We don't advise. We are just there to help you to listen.
Because everybody, there is this saying, everybody just wants a validation. Everybody wants somebody to tell him it's okay. Yeah. And that is one thing that is really lacking in current society, because the world is sometimes very cruel.
Yeah.
So therapists, you guys, you're there when I feel like I'm done.
You've seen people go like their hospitals, they do screening and they say, come even if you don't feel
like you want to be screened, just come.
Just come. We are not saying you have that disease, just come.
Come to be screened.
Let's check your urine. You never know if you're okay.
What happens if you just go and you find it? Anyway, on that note, you're going to take a short break and be back. Thank you so much. See you in the next segment.